I have to take a moment and applaud the courage of the Price family. I can't imagine what you've been through and how brave it is of you to share your story with us. And we hope we can get some really interesting conversations going this morning to see if we can't do something to change a few things. Wow, what a film. You know, as a parent, that really hits home. It really does. So let's see if we can do something about that, shall we? Okay, let's bring up Ward. Let me give you a little background on Dr. Ward Flemons. Ward Flemons is a respirologist at the Foothills Medical Center and the Tom Baker Cancer Center and a professor of medicine at the University of Calgary's Cummings School of Medicine. He is also a medical director with the Health Quality Council of Alberta and has spent many years working with patients and families who have experienced serious patient harm events in healthcare. Ward is going to moderate a panel now with the people involved in the making of this film. I'll take this over to you, Ward. Oh, you've got your own microphone.
I'm going to steal my own.
There you go.
Thanks, Leo.
And we're live. Terrific.
Good evening. So we thought that before we got into the heavy discussion about the issues that the film raises, that we would perhaps enlighten you as to how the film actually came to be. So I'm going to ask several people to come and join me up here. First of all, Andrew Reggett, who wrote the screenplay and basically was the person that instrumented a lot of the workings of the film along with his wife, Becky. And Dean Bennett, the director of the film. And Terry Price, who was one of the executive producers of the film. And Kevin McGarry. And I probably don't need to tell you who Kevin was, but for those of you with vision problems, Kevin was the lead actor. So we're going to take about 15 or 20 minutes and just talk a little bit about how this incredible film came to be. And it really started from an idea that I had when I was working at the W21C and teaching medical students. And Dave and the rest of the Price family had been kind enough to allow me to tell Greg's story to the first-year medical students. And I was impressed at how much of an impact it had on it. I was even more impressed in those situations where I'd been in a situation where Dave was actually also there telling people a little bit about who Greg was. And that spawned an idea to create a bit of a film to show the students who Greg was so that it would enhance their learning. And a colleague and a friend of mine at W21C where I work, Peter Sargis, said to me one day, I hear you're thinking about making a film or would like to make a film. You might want to meet a friend of mine that I run with. He's in the business. And I said, okay, let's do it. So he introduced me to Andrew Reggett and Becky Shaw. Becky is Andrew's wife. And sat down and heard a little bit about Greg's story and got engaged. And I'm going to turn things over to Andrew to talk a little bit about what it was that drew he and Becky in.
Sure. When Ward first got in touch with Becky and I, we didn't know Greg's story. I didn't know anything about it. But as Ward described it, there were a lot of aspects of the story that felt very familiar to Becky and I because we'd gone through some issues with her mom and in the hospital and in the healthcare system, and some of the things that we saw Greg going through. Thought, yeah, that sounds familiar, and it sounds like this is an attempt to try and do something about those gaps. And so we met Dave and Terry. And we're kind of blown away by what an amazing family they are and the determination and courage that they had to really do something. I thought, well, if they're willing to do something, so am I. So let's so Becky and I both felt like, yeah, we want to be part of this. And then the discussion was, well, what is it? Like, how? What are we trying to make, and what do we want the outcome to be? And we knew that we wanted an educational piece, but we weren't, the more we talked about it, the more it became clear that what we really needed to do was we needed people to know who Greg was. We needed to know that there was a human being behind this, a very loved person. And there were a lot of people, a community and a family who were really grieving and hurting and who wanted to do something so this doesn't happen to anyone else. And you know, that really cemented things. You know, once we realized that we were going to tell the story from Greg's point of view. I don't know about being a doctor. I just, you know, make TV. But I know about being a patient, and I've seen that. So I thought, well, let's tell it from that point of view and tell it as accurately as we possibly can and just let the story speak for itself.
Great. Thanks, Andrea. And I wanted Terry just to jump in and talk a little bit about what she and the rest of her family saw in Andrew and in the potential behind this, and what got you engaged in sort of moving this whole project ahead.
Yeah, well, from the beginning, we were excited about the potential to have an impact on future doctors. That's really where the initial idea came from, was for you to be able to use it at the med school. And so that seemed like a very worthwhile reason to do the project. I think the project evolved several times. I think we were talking about doing a series of video modules to start that we could potentially turn into a 1-hour documentary, and then that shifted again, and we ended up with the short film, which I'm really happy that this is the end result. The 30 minutes is really valuable. I think it'll get shown in a ton of different venues because it works in conferences, it works in the classroom, it works to really have enough time to have a good conversation afterwards. And I think that's really one of the most important pieces with the film, is that there is the opportunity to sort of engage with the broader community, and both like sort of general public and the community inside the healthcare system. Because I think that's where the real power and the change is going to happen, is when we have everybody sort of working together and collaborating on what the best way forward is. The system's not going to get fixed if everybody stays in silos, so we really do need to work together. And I think the film really does that. It kind of breaks down the barriers and gets people thinking about, okay, like, we need to move forward and figure out how to prevent this from happening again. And so I never imagined that we would end up with a film of this quality, and the positive feedback that we've received so far has been a little bit overwhelming at times, but it is a true testament to the team that was involved. And I've been lucky enough to be in the room for a bunch of the screenings and the discussions that we've had after, and we very consistently hear praise for the quality of the film and the fact that it really does put people into Greg's shoes, and they experience it from the patient side, which is unique and really important. And so I had basically zero experience with the film industry before, and have a huge amount of respect for the team. The sort of topic for the courses that Ward wanted to use the film for is for teaching teamwork. And there was moments where we were sitting back just saying we should just be filming the film crew because they haven't all figured out. So
we were really lucky. We had Karen Pickles, who's a wonderful producer, who came and put all of this together in you know, a very short time frame and limited budget, and then I was fortunate enough to lean on my friend Dean here to direct. And why don't you say something about?
Yeah.
I shall. It began for me with a phone call from Andrew, or an email, presenting the idea of the story sort of in short form, and pointed me towards what the original, or the website as it was at that point, with the bullet points. I was shocked by the story. And I said, yes, I'll take whatever initial steps with Andrew. I was delighted. I've worked with Andrew, and Andrew is, among others, part of how I got into the industry as a director. So I used to be a director of photography, and he helped me with that transition, so I was delighted. We went out. The first step was to go out and, in a research mission to the family on the farm, and I was honored to be present. Normally as a director, you're not in at that early stage, and it was there that I met Dr. Fleming and in fact the entire Price family, and was very moved the evening was moving. It felt like it was 2 or 3 hours. I don't know. You can correct me on that. Where each family member gave part of their story and memories of life with Greg, and also stories about the 400 plus days and how it affected all of them. And I was deeply moved. Due to circumstances, though, and just getting the film together, I ended up doing another job, and a very full-time job. And I, at one point, phoned and said, "I'm going to have to bow out. This isn't going to work for me." But Andrew, exactly. He had a draft of the script ready, and or shortly thereafter anyway, and sent it over to me and said, "Can you just read it?" And I did read it, phoned him back, and I said, I've made a big move in what I'm doing. I just cannot do it. And but give me 3 days to think about it. And so that was the. I was completely stolen, and my heart was stolen, and it was stolen by the family, by the story by Greg's story. But very much for me, it was the family. So authentic. They might not like me to say it, but it's a Renaissance family right across the board. These are original thinkers, and I so admired that this was being done for all the right reasons. And so for me, it was all in.
So
And when I read it, I was just going to say, I read it and said yes less than 3 days later. And had a conversation with Andrew shortly after that and said, "Would you consider Kevin McGarry?" And I'm going to pass the microphone over to Kevin.
I have one.
Oh, he has one. But I want to just say one other lovely thing. Actors typically stand in audition lines for most of their life, rejection notes and everything else. And one of the joys that Andrew put forward was, we know all these people. They do great work. Can we just approach them? And the only casting we did was to decide which roles those people would take. And I think it was a big love fest throughout. But it started with Kevin. I'll let Kevin say a few words.
On Love Fest? That's what you're giving me to move into? I mean, I guess when Dean asked me to do this, I like Dean, and I was like, I'd love to work on something with Dean. That'd be great. And then he gave me the script, and I read it, and I thought there was something special there. And then we left work one day and went to a read-through. I think it was at Terry's house. And I think that was, most of the cast was there, if not all the cast. I got my memory. And I think that was the moment that I was like, oh man, this is something that is important and has to be told and is going to mean something to people. And I think, as a storyteller, an actor or director or writer or producer, to be involved in something that can change the way people think or sort of movement is just, that's what I love. That's what I got into this for. And I knew that it was going to be really special. And the Price family, they were nothing but supportive, because it was daunting in the beginning to be like, oh man, they're going to be on set every day. And then, but yeah, just nothing but supportive and kind and loving, and everyone was there for the right reasons. And yeah, as tragic as the story was, it was like a joy to come together and tell it with all of you.
So I'm just going to pick up really quickly on something that Andrew, I think, was quoted in the papers saying, which is when he approached Dean, Dean had 6 days off last summer and took 5 of them to shoot the film. So that's a huge testament, I think, to commitment. And as I think Andrew also, nobody was in it to make any money. This was done on a bare bones budget to make it possible. But what motivates people to really want to pull together like that? And Dean, you pulled in a lot of people, I think, to work on this film.
I have to credit Karen. Can you stand up, please? And in fact, Car-
How about everybody in the cast?
yeah, and all the rest of the cast and crew that is here.
Yeah,
If
we
you
have
are in
several cast
the
members.
film or working on the film, please stand.
Can we have the rest of the cast stand up? And Nick, our
Over here.
crew.
And we did our prep spread over 3 months. To hold that together, I put all the credit to Karen. Yeah.
Yes, that's fantastic. Thank you very much. So I think with that, we'll turn things back over to Leah.
Sure.
And we'll get on to our next panel discussion. Thank you very much for
Thank you all so
coming.
much.